I had to create a new link for it.
Sure. Hi, guys. Good morning and welcome to another AM session. I'm Dr. Ben Benham, founder and chief medical officer of Happy Head. So, today is another AMA session. Please remember that this is our disclaimer before we get started. I want to remind everyone that information here is for educational purposes only and is not meant to provide any medical advice or services. Please do not rely on this information to make any medical decisions, and remember to discuss the risks and benefits of any treatment option with your own doctor before starting treatment. And remember that this does not establish any patient-doctor relationship. All right, guys, let's go through the questions. So, what is latanoprost? So, latanoprost is so I'm going to give you a story. So the story is that years ago there used to be all these eyelash extension growth factors, and one of them was called Latisse, and Latisse uses the ingredient latanoprost. Latanoprost in the old days used to be and basically it's a glaucoma medication. So doctors would prescribe for patients with glaucoma, and they would basically put the eye drops into the eye, and they realized that caused the eyelashes to grow thicker. So then people made that basically for specific for eyelash and eyebrows, and then people also made it for the scalp. It does help a little bit basically with growing the hair, but I think alone by itself doesn't work that great. It's going to work really well when you use it in conjunction with other stuff. Is latanoprost better for type 4 hair? uh what do you mean type 4 hair?
Girls, I
Oh,
think.
okay.
Yeah.
I mean, so there's really no distinctions between like the different type of hair types that it's good for. I mean, in general, it's good basically for hair loss, but it's not really specific for one type of hair or the other one. What is dutasteride and what are the pros and cons? So dutasteride is a DHT blocker, which basically means that it takes, so usually testosterone gets converted to DHT, and there are two enzymes that are responsible for doing that, and dutasteride inhibits both of those enzymes. The pros of dutasteride is that compared to other drugs like finasteride, it's inhibiting two enzymes as opposed to one. So, so as a result, you get a much better DHT reduction compared to finasteride. Specifically, I think if you use finasteride, you end up with a DHT reduction of about 70%, whereas if you use dutasteride, you end up with a DHT reduction of about 90%. And in clinical studies, oral dutasteride has been shown to have a much better efficacy than oral finasteride. What are the cons? Well, cons of obviously, is taking a medication or pill every day. Please remember that with every drug, there are side effects, and the side effects of the DHT blockers, such as finasteride or dutasteride, includes um, sexual side effects like decreased libido, erectile dysfunction, testicular pain, testicular numbness, or sometimes patients could have slightly get saddened or depression. So those things could happen as well, and I want my patients to be aware of it. Is it true that dutasteride has a less risk of side effects? So there are many studies done on oral dutasteride compared to oral finasteride. In majority of those studies, basically it's been shown that the side effects profiles are the same. Uh, Specifically, none of those studies state that dutasteride had a worse sexual side effect than finasteride. There is one report, I think it's out of 2021, out of Urology Journal, stating that they did a retrospective analysis of all the sexual side effects, finasteride and dutasteride. And dutasteride seemed to have lower risk of side effects, according to that report, with respect to their sex, like sexual side, like erectile dysfunction and libido. So in some aspects, there is a report that said dutasteride could have a lower risk of sexual side effects. I live in a hot climate and sweat around my scalp. Will this affect my treatment? Typically not. No. Is it okay to use Happy Ed when I have pimples on my scalp? I mean, if you have a couple pimples here and there, it's okay to use it. But if your scalp has gotten really irritated and is raw and is tender, please take several days off. What does hair look like for women versus men? What does hair loss look like for women? That's a great question. So how does the hair loss look like? So the hair loss. So you have. So actually, it's a very interesting question. So because females and males lose hair differently. So females tend to lose hair on the top. So really like right here, what we call the top scalp area. Um, Males tend to lose the hair in the widow's area, so basically it goes gently up right here, and also in the crown area. And sometimes when it gets really bad, so basically they become complete bald. So that's how the hair loss is different, both men and women. What is the advanced formula? And is it better than dutasteride, even though the highest concentration is zero point 0.1 finasteride and zero point 0.1 dutasteride? So the advanced formula uses the combination of finasteride and dutasteride together, compared to using dutasteride separately and using topical finasteride separately. When you use the drug separately, they're at a higher dosage, like which is zero point 0.3, but when you combine together, the dosage is less. Despite the fact that dosage is less, I still believe that the advanced formula could be more effective, just because you have two different drugs working as opposed to having a single drug working. And also from our patients' feedback, that tells us it works better. What happens if I stop taking Happy Head? Well, if you stop taking Happy Head, the gains that you've already made basically will go away, unfortunately. It's like, for example, taking your cholesterol medication every day and you stop taking it. Well, your cholesterol is going to start to go up. I mean, it's really the same concept. What studies show that the dutasteride topical solution is successful in less than 1% solutions? I've seen successful studies only 1% solution and above. Um, Okay, so that I have not seen that study. So basically, I guess this question is saying that the topical potassium solution only works in 1% of patients. I don't think that's correct at all. I mean, we have a lot of patients that do dutasteride, and they're very happy about it. So, if that was the case, then no one would ever stay on the topical. But I'd love to see the study if you could send it in. Um, it's all of our solutions are less than 1%. I don't understand what that question means.
Like 0.3%, 0.1%.
Oh,
Like for the finasteride and dutasteride, basically why?
okay. That's a very good question. So basically, you're asking why we came up with that 0.3% as opposed not to make it 1%. Okay. So if you look at some of the pharmacokinetic studies that were published back in 2015 and 16, and they are published actually on our website. I know that as a fact because I published it myself years ago. Uh, the studies showed, the study tried to see what level of the drug that you apply topically will result in the same DHT reduction in your serum. So they had the patient take the oral Propecia and they measured the blood, measuring the serum DHT level. And then they had the patient do the topical application and they measured their blood serum DHT level. And for the topical, there were different concentrations. I think there was zero point 0.1, zero point 0.2, 0.25, 1. And they realized that the topical concentration that gives you the same pharmacokinetic reduction in serum DHT as the oral medication is finasteride 0.25. So that's how like originally like a lot of our formulas was initially 0.25. I mean, we obviously made it a little higher to zero point 0.3. Now, there are doctors that are probably doing finasteride 1%. I mean, they're going beyond any of the studies that are already out there. And, look, we love our patients to get good results, but at the same time, we don't want to basically harm our patients. So we basically are are calculating and producing our formulas based on studies already out there. So that's why basically ours is less than 1% concentration. That's a very complicated question to ask, but that's how we came up with the formula. That's really essentially what it's asking. Should I be washing my hair more or less in the summertime? Yeah, I mean, you should still wash your hair like like 2 or 3 times a week, you know, every other day. What product should I use? Oh, by the way, I'm gonna go back to the washing. You could wash your hair every day, but just don't put a shampoo in it. Uh, but if you're gonna use a shampoo, I would do the shampoo every other day. What product should I use if I have dermatitis? So if you have dermatitis from the topical, please stop using the product for like about a week. Let the dermatitis go down, and then you can resume again. If your scalp is extremely like very itchy, you could also buy some cortisone 10 over the counter and apply it to your scalp twice a day. And if it's really itchy, then please reach out to your doctor through the portal, and they might have other prescription topical steroids that could apply to minimize the irritation and dermatitis. What is the difference between the topical treatment and the oil treatment? Is one better than the other? What oil treatment are we talking about?
The oral versions. Of
The oral or
medication.
the oil? Or the oral, I see. Sorry, oral version. Okay, it said oil. Okay, oral treatment. Okay, so so the difference is that look, topical you have to apply every day to your scalp, whereas the oral is just easy. Something just take the tablets and move on. Look, some people feel it's easier to take the oral and move on with the day, and that's it. But like a lot of patients also don't want to take them systematically. So at that point, basically the topical treatment becomes your best treatment option. So so really to make sure that you get the right product, you have to ask yourself, um, what is going to be easier for me to do? Am I going to basically be able to go ahead and apply this to my scalp once or twice a day? Or am I the type of person basically that if I just take a pill every day, that's going to be the easiest thing? So you really got to answer that question. And based on that, basically, you can really decide if you want to go with the topical route and the oral route. Now, which one is better? Well, the topical has three ingredients compared to the oral medication that has one ingredient. So the topical is still very effective, but sometimes the oral could also be effective for some patients as well. So the results really varies, and you really don't know exactly which one is going to work better for you. Minoxidil can cause puffiness underneath the eyes. Does dutasteride does do it as well? The answer is no. The reason why minoxidil causes the puffiness is because it increases blood flow to the area and causes vasodilation, and some of the fluid seeps out, and what causes the puffiness. It doesn't happen to everyone. Dutasteride does not function like that. Dutasteride is not a vasodilator. It's a DHT blocker, so it does not cause puffiness underneath the eyes. Is the reason that you went with the retinoid versus tretinoin in your ingredient? Actually, ours is retinoic acid. Actually, so it's pretty much this is the same thing. What product do you recommend for someone with dermatitis? I mean, if you have dermatitis, I would probably. I mean, that means you have sensitive scalp, so I would probably go with the liposomal formula, but the liposomal formula does not have like a lot of alcohol in it, and it's gonna be not as irritating. So the liposomal doesn't have alcohol in it. It is not irritating and is only once a day. So it's easier to apply and is not as irritating. So I will go with the liposomal. How effective is the standard method compared to only using one product? I think it's actually really much more effective in my personal opinion. I have a lot of patients that have been on finasteride for like 10 years and they come back to like, doc, what should I do? Can I do anything else? And literally I add a little more topical finasteride to the regimen, and all of a sudden they're back going again, growing out again their hair. So I think the sandwich method really makes a huge difference. And if you think about it, it makes sense. Look, when you take a pill orally, it has to travel your entire body and it's really trying to work from inside out. When you apply something topically, it's really working on that local hair loss environment to really cause the hair growth. So although the mechanism of action, the oral and topical may be the same, but it's the method of delivery that's really different, and it could really, if combined together, give you much better results. So, guys, a couple things. So, first of all, at Happy, we focus on customizing our products, which means that if we give you a product and you don't like it, you just let us know and we'll take whatever we need to, any ingredients out, or we could add ingredients in there to customize the product just for you. We're the only telehealth hair company that does customizable products. Our product doesn't sit on shelves for months and months and months. It's literally made fresh for you, and we send it out. And also, we do not believe that every person is the same. We truly believe that every person's hair loss is different and unique, and this is why we customize the products just for every that individual person. We can also lower the concentration depending upon your needs. Again, there's a lot of happy head perks that we have, so always reach out to us, and we're here to help you out. Um, how does the sign up process work? So it's really simple. You go on our website, you fill out a very short questionnaire, upload your photo, and basically submit it in. It literally takes probably 5 minutes. And then you get connected to your doctor, and the doctor basically will write the prescription based upon your photos and your past medical history. And where the prescription gets sent to the pharmacy, and the pharmacy makes the bottle and ships it out to you. So literally, all you need to do is just fill out the questionnaire and just wait for the bottle to come to your house. How does one change the formula? It's easy. You just go to happyit.com/help and just talk to one of our assistants, hair specialist, and they'll be happy to change the formula for you. Once we change the formula, we actually have to send that request to the doctor to have a new prescription written, and a new bottle is meant for you and shipped out. Can we use Happy Head on beards? I would not recommend using it. We are coming up with a beard formula. We're just unfortunately not there yet. The reason why I wouldn't recommend using Happy on the beard area because it has hydrocortisone, and we don't recommend using the hydrocortisone chronically on the face. On the scalp is a different story, but on the face we don't recommend it. Um, so, guys, let's go to product alert. We should have like a banner or like balloons. Topical super solution. Topical solution. Okay, so what is it? The super solution. So basically, this is our new vehicle, what we also refer to as the liposomal formula. And what it is that it's a vehicle um, where basically the product is slowly released into your scalp, and as a result of that, it also kind of decreases the absorption directly into like blood area. So reduce the absorption, and is a slow release formula. So this has basically a couple benefits. So what are the pros? So first of all, is a 1 day application as opposed to twice a day application, which is great. Number two, the product is kind of like a lotion, and it's not a liquid dropper, so it's not messy, doesn't get on your face. But also, it has no alcohol in it at all, so it's not irritating, doesn't cause dermatitis, um, and um, and thirdly, it still has pretty much all the same ingredients as our regular formula. And number four, again, it's a slow absorption into the scalp, which reduces the risk of systemic absorption. Really, that's how it works. So there are a lot of benefits. How do I use it? You just basically apply once a day to the affected area. How can I order it? You just order on our website. And pretty much anyone you could use it. This is mainly we have the financial version, so it's mainly for males and females above age 50. Is Happy the first on the market with the liposomal formula? We are the first one to massively distribute it. Yes, we are. What makes ours different than the other competitors? There's like another competitor out there. What makes ours different is that, first of all, ours doesn't just have finasteride in it. Ours has finasteride and minoxidil. Um, so it has two ingredients as opposed to one, which is better. And number two, our liposomal formula is basically designed in such a way there's a slow release. So you're not doing it twice a day, you're only doing it once a day. Again, I'm a very big fan of the liposomal, and I'm super excited about it. And the patients who've already been using it are super excited as well. So let's talk about the account page. So Happyit is a subscription service, which means that in order for you to get your product on a monthly basis, this automatically renews, which is great for you because then you don't have to constantly like call us up, say like give me another bottle. It just renews and gets shipped directly to your house. You can self-serve everything online on your account page once you've placed an order. You can request to adjust your subscription frequency and change the refill dates at any time you want. I mean, basically, we're here to cater to you. And if there's anything that you cannot do on your account page, it's very simple. You just go to happyhead.com/help, talk to one of our team, a hair specialist, and look, we'll fix everything for you. We'll skip, one of your subscription. We'll change your subscription frequency for you if you need to. We'll change your formula. We're here to help you out. At Happyhead, we're focused on your hair growth, and we're here to assist you to get that goal accomplished. And again, remember, Happyhead assigns you a board-certified dermatologist, and I think what really makes Happyhead unique compared to other companies that do like a lot of hair care in this sector is that all of our doctors are board-certified dermatologists. We just don't have any nurse or PA that does it who really doesn't have any experience. These are physicians that went to dermatology school, trained in hair, and they're trained even more in hair before they come on board with Happyhead. So we are hair specialists. We know what we're doing. And again, everything through and all the messaging with the doctor goes to a HIPAA secured doctor-patient chat. Um, so how effective is the standard method compared to only using one product? I mean, I don't think there's any number on that. Uh, I can't tell you how effective it is, but I know from my patient experience that it's more effective. Guys, thank you so much for tuning in. If you're a Happyhead fan, make sure to give us a review on our BB page. We really appreciate it. We're going to link that post in this chat. Again, remember that our team of hair loss specialists are available to answer any of your questions that you may have. You could definitely visit our website to chat with anyone directly from 7 a.m. to 5 p.m. Pacific Standard Time. Again, we would really appreciate if you would leave us some reviews on our Facebook page, which is Facebook/HiHappyEd/reviews, or our Better Business Bureau page, or the Trustpilot page. So again, I want to thank everyone. By the way, guys, I'm not the only one here. We have a whole team here that basically makes this all possible. So I really appreciate it. Everyone. Thank you so much. You guys have a great week, and we're gonna see you guys on the next MA session. Thank you so much. Bye, guys. 1 second. Not streaming.